Welcome to Module 5 of the course Plus Inclusive Education from Reflection to Action. We now enter one of the most specific and practical modules of our course. The aim of the last 3 modules is to train the educational community in 3 of the most common development disorders in childhood and mainstream school classrooms. In this module, we will focus on knowing to understand Autism Spectrum Disorder. In this module, we will understand Autism Spectrum Disorder, ASD, what it is, what are the main symptoms and characteristics, the importance of concepts associated with neurodiversity, and main symptoms associated with autism spectrum. Talk about the importance of the right educational environment, from the classroom environment to common spaces for recreation and cafeteria. We will develop which are the most appropriate pedagogical practices. We will also talk about the challenging behaviors and what are the most appropriate behavior management practices. We'll talk about where you can find suitable learning resources. And we end with a teacher survival guide and a handout as practical tools. The objectives of this module are: be able to recognize some features associated with the autism spectrum, identify inclusive resources and good practice targeted at learners within the autism spectrum, identify ways to create an inclusive classroom for children on the autism spectrum, to adjust pedagogical didactic practices that promote the potential of all students. Let's get to know and understand autism. It is a neurodevelopmental disorder, so it is more correct to say autism spectrum disorder, which has associated characteristics, communication and social interaction deficit and behavioral changes. Why autism spectrum? Because it is not a single profile. It is a set of subgroups with specific characteristics which affect the behavior and social relations of the subjects with this medical condition. Being a specter, children diagnosed with this condition present different levels not only of difficulties and needs, but also of capacities, namely at an intellectual level. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, labels these disorders as a spectrum precisely because they manifest themselves at different levels of intensity. A person diagnosed as grade 1 has mild impairments, which may not prevent them from studying, working, and socializing. An individual with grade 2 has a lower degree of independence and needs some help to perform daily functions, such as bathing or preparing meals. The autistic person with grade 3 will manifest severe difficulties and usually needs specialized support throughout life. Diagnosis. It usually happens in the first 3 years of life. However, children whose school skills and competences develop during the usual age have a late diagnosis. The spectrum is so broad that there is the possibility of people with mild symptoms of autism spectrum disorder being diagnosed as adults, which makes not only the intervention but also the allocation of supports that benefit them difficult. Science has not yet discovered the real cause of this disorder, but there is a consensus that a combination of genetic, neurological, and environmental factors may underlie this medical condition. There are 2 factors that must be present to confirm that a person has autism. The so-called diagnostic criteria are the presence of impairment in communication and social interaction and the existence of repetitive and restrictive behaviors. Each person with autistic spectrum disorder will manifest these 2 elements in different levels of intensity, which will define where he is in the autistic spectrum. But autism is not a disorder that occurs in isolation, and that is where comorbidities come in. Besides the 3 levels associated with autism, the variety is immense. Autism can manifest a multitude of comorbidities and also be associated with different syndromes. Symptoms associated with this disorder. Despite the existence of subgroups within this disorder, we can highlight a triad of symptoms that affect behavior in the following dimensions: understanding and using verbal and nonverbal communication, Many children with this disorder find it difficult not only to communicate effectively, but also to understand the communication and language of others. Furthermore, many of them have speech delays and others do not develop this competence at all. In these situations, it is important to use resources such as images, photographs, and gestures, for example, as a way of stimulating this competence. Ability to interact with children and adults, and difficulty in establishing or maintaining social relationships. Children with an autism spectrum disorder have difficulties with social behavior and social interactions. It is difficult for them to understand the social behavior of others, as well as to maintain socially appropriate behavior. These children, in a social context, regularly manifest difficulty in playing or socializing and communicating with peers, and sometimes this behavior may be understood as a lack of education or even lead to the belief that this child is lazy. Misinterpretations arising from total ignorance of this disorder. Repetitive and obsessive behaviors. It is normal for children with this condition to display repetitive behavior. For example, these children do not play with toys in the traditional way. They prefer to watch or spin objects repetitively and constantly, or, for example, spin a wheel of a trolley with excessive concentration and for long periods of time. On the other hand, there are children who develop interests in activities or themes. Despite the mentioned, there is a tendency for these children to play in isolation from their peers. Other relevant symptoms more associated with communication and social interaction are delayed or even absent speech, including loss of hitherto acquired language. Incorrect use of pronouns, replace I with you. Difficulty in playing with peers. Absence of eye contact or difficulty to taking the relative's hand with the intention of guiding him or her to an object or activity he or she wants to do. Rare recreational interests or activities. Atypical responses to sounds, smells and textures, tastes and images. Resistance to changing routines. They can manifest dysregulated sleep patterns as well as we have seen behavioral problems. Some statistics that tell us about what we see and often do not understand. According to Our World in Data in 2016, about 18 million people in the world had autism. 13 million of the subjects with autism were male, 5 million female. Why are male subjects more often diagnosed with autism? According to the American Association of Pediatrics, males have more severe symptoms, namely repetitive behaviors and very restricted interests, which facilitates its diagnosis. Girls, on the other hand, have a broader and less perceptible set of symptoms, which is why it is often only diagnosed in adulthood. A different way of seeing the world. Some children with autistic spectrum disorder may have different perceptions at the level of the senses, that is, at the level of sounds, smells, touch, sight and tastes, affecting their reaction to them. This hypersensitivity has implications not only at home, but also at school. These children have, in fact, a peculiar way of seeing, feeling, and reacting to reality. Distinctive capabilities. Despite the difficulties previously mentioned, the truth is that most of these subjects present a set of capacities, namely A. Ability to concentrate on details and activities of interest, often for long periods of time. B. Ability to direct attention to a particular task and/or activity, thus developing, most of the time, an excellent skill level compared to other subjects. C. Better ability to capture information through vision than orally. D. Because of their specificities, these children are more likely to achieve academic success in technical, mathematical areas such as engineering, ICT, and music. It is important we know that the autism spectrum disorder presents a set of characteristics that hinder the child's way of being. However, it is fundamental that we perceive these characteristics as a way of seeing and feeling the world distinct from others. Owning up to this vision is crucial for society not to focus only on the difficulties that this condition entails. Encourage people to value the abilities of these children so that they can develop their interests and activities in a healthy way. Therefore, parents, relatives, teachers, and other professionals are invited to assume an empathic role and try to put on the shoes of these children. Only in this way can they understand and help them to overcome their difficulties and also enhance their capacities by adapting appropriate strategies. We now talk about some concepts that may seem new but are recognized as the most correct terms when we want to talk about disorders such as autism spectrum. The concept of neurodiversity. Neurodiversity is a concept that covers all human neurological compositions, whether typical or atypical, the case of people with autism. The neurodiversity look allows us to understand neurodevelopmental disorders not as something out of the ordinary or in need of cure, but as part of the immense variety of natural brain formations possible among human beings. It is the idea of neurodiversity that helps us understand that autism has no cure. Autism is a condition, among many others, with which some human beings are born and that, due to its specificities, requires specialized monitoring so that the person, like any other, can develop fully within its potentialities. To clear up any doubts about the adoption of the most correct terms to refer to people with autism, without autism, or with other types of disorders, these are the most correct concepts. Neurodivergent. Term used to designate people who present alterations in cognitive, behavioral, neurological, and neuroanatomical functioning. In other words, they refer to alterations such as Autistic Spectrum Disorder, ASD, Attention Deficit Hyperactivity Disorder, ADHD, Tourette Syndrome, depression, dyslexia, schizophrenia, among others. Neurotypical. It is a term that refers to subjects that present typical neurological development and functioning, that is, within regular patterns. We can use this term to mention, for example, a functional adult or child who does not present significant alterations in memory, attention, cognition, and so on. The term neurotypical denotes individuals who do not manifest neurological or neurodevelopmental changes, such as autism. People with autism spectrum disorder are considered neuroatypical people. All of us, neurotypical and neuroatypical, are neurodiverse. Educational environment. The educational needs of children vary according to their potential, needs, and interests. Therefore, an individual evaluation is fundamental to determine the most adequate pedagogical strategy. Moreover, it is necessary to know the child, first of all through the eyes of the family, who knows the child best. By default, we tend to emphasize children's abilities and seek stimuli for their limitations. Each of us should be seen from our abilities because they are the ones that open possibilities to eliminate some barriers and manage our limitations. Often educational practices seek to train students in a specific skill, often disconnected from the context. When we talk about a disability condition, we know that associated to this condition are limitations that cause losses in the person's life. However, depending on the stimuli, the environment, and the context, these same limitations could not bring losses or harm to the person's life. It is essential to know people's needs and seek to ensure accessibility. By knowing the person's characteristics and interests, we will know how to meet those needs. In Portugal, for instance, these children develop their academic path in regular schools, where they are allocated learning support measures. However, this reality is not transversal to the majority of the education systems. In other countries, the reality is different, since these children attend schools aimed at the education of children with learning difficulties or specific schools in the area of autism. How to adapt the educational environment, particularly in the classroom. 1. Reducing visual and tactile noise. That is, keeping materials out of sight when not in use. Some children may be overloaded or overstimulated by too much information, so it is important to reduce disorganization. In this sense, it is important: A. Determine a specific place for things. For example, toys in a container, papers and pens in a drawer, etc. B. Keep distracting material away from the child's environment. C. If there are visible containers on the classroom shelves, they should be camouflaged so as not to distract the student, thus avoiding situations such as moving and taking away materials. D. Draw up and determine a schedule for students to fetch the materials or give direct and clear instructions for doing so. For students who have difficulty reading and/or understanding verbal language, use words and pictures to indicate what is intended. This will help the student to identify where, for example, they can fetch the toys or materials. Reduce what is exposed on the walls. Children with this condition can often be easily distracted by the materials on display and/or decorations on the walls. Therefore, in order to minimize distraction, it is important that care is taken to keep these decorations in one place in the classroom, rather than using the whole space. The reduction of visual stimulus is important for the stability of these children. Defining areas in the classroom or learning space. This strategy is adopted in classroom environments where there are several spaces: reading area, science area, play area, among others. To delimit these areas, professionals can use different colored carpets or dividers with bookshelves or other materials. Drawing up a timetable, written or using pictures. In order to organize how students will use the classroom space, it is important to draw up a timetable. With a timetable, the student knows when he or she will be in a certain space. Some students find it easier when they use mini schedules, for example, first do the puzzle, then computer activity. In order for the children to know what activities have been carried out, teachers can opt for a timetable where the different components are removed so that the children know which parts have already been completed and what they still have to do, like the example we see in the picture. Personalized definition of the pupil's specific place. Many students have the need to have their specific place to develop a certain task. For example, a child who has difficulty staying in his or her designated area in the classroom may benefit from tape on the floor around his or her seat, so that he or she knows where he or she is expected to be. We address some good practices to consider in the classroom context, regardless of the difficulty that the student presents. When we talk about students with Autism Spectrum Disorder, it is essential to mention more specific strategies. A welcoming and relaxing environment is essential for students in the autist setting. Creating this environment means, for example, including books, comfortable blankets, and some calming objects. A. Stability ball. B. Swivel chairs. Some classrooms are replacing traditional chairs with this alternative. C. Suspended swing or a trampoline. In addition to the objects mentioned, there is the possibility of including rest or self-regulation spaces aimed at students who need breaks throughout the day. Sensory objects can also be included in classrooms. Incorporate sensory items in the break area or allow students to use fidget objects as a way to self-regulate and provide well-being. Students should have direct and clear guidance about how these objects are used in the classroom, thus avoiding distracting moments. We now talk about good practices in the common recreational and dining areas. Playtime and lunch are the least structured and therefore most difficult times of the day for a child with communication and organizational challenges. Figuring out how to keep busy and have fun in a playground with no set rules is the big challenge. How can the school welcome these students without segregating them in more isolated and silent areas of the school? By creating specific signs and spaces that make it easy to interpret where he can go and what he will find. In the same way, in the canteen area, the area where the child sits can be visually signposted. The child should avoid having lunch during the busiest periods. You can choose a quiet place within the dining area to ensure less hectic lunches. Having a visual menu always available makes it easier for the student to make choices and communicate. In addition to organizational and sensory issues, this is a time when deficits in communication and social skills become noticeable and very painful. Lunchroom management and playground responsibilities fall to operational staff, and it is necessary to get these professionals some understanding of what autism is and the basic strategies that will make a difference to a pupil in the autistic picture. It is important to mention that in these spaces, fire alarms or certain bells and chimes can represent a sensorial violence. Pedagogical practices. Students within the framework of autism are challenged daily in various contexts, including education. It is essential to implement pedagogical strategies appropriate to the real learning needs of these students. This is why we have addressed some strategies that can be found in more detail in the Good Practice Handbook plus Inclusive Education. 1. Limiting sensory stimuli. According to some studies, classrooms can be hectic spaces where the permanence of sensory stimuli can be quite disturbing for these children. Here, the teacher has an important role, not only in identifying the stimulus, but also in managing the sensory overload present, not only in the classroom, but also in the playground. Therefore, it is fundamental that the teacher gives, for example, some minutes to relax after the break, among other important behaviors for the well-being of these students. Allowing students to leave 5 minutes early to avoid confusion in the corridors is also good practice. 2. Use of the Applied Behavior Analysis method. Applied Behavior Analysis, or ABA, is a therapy that contributes to teaching new skills as well as supporting the learning of the student with Autism Spectrum Disorder. This intervention consists not only in the acquisition of skills, but in the improvement of the ones that already exist. Moreover, it also focuses on the attenuation of certain behaviors that compromise the social interaction of these students. In an initial phase, it involves identifying the behaviors and skills that need to be improved, for example, communication, social interaction, among others. Subsequently, an intervention based on behavioral strategies is outlined. This intervention is known as an assessment before, during, and after the interventions, something fundamental not only to analyze the student's progress, but also to help in decisions regarding future interventions in order to improve and promote the development of communication, social interaction, daily life activities, motor and academic skills. This method can be applied by any health or educational professional, as long as they are certified by the Behavior Analyst Certification Board, BACB. Studies show that this long-term intervention brings benefits for students with this condition, namely in terms of behavior, communication, and socialization. 3. Provide appropriate responses to students. Students with this condition have difficulties in communication and, in this sense, it is essential to maintain a coherent, clear, and direct speech when answering, asking questions, or giving directions. It is important to take care to avoid metaphorical and abstract language, as it will facilitate the student's understanding, to instill in the student knowledge about what they can and cannot do. Example, creating make-believe situations. Set expectations regarding the completion of work, as well as clearly communicate clear expectations and rules regarding behavior. 4. Reading comprehension strategies. Reading difficulties are common among children with this condition, so teachers should pay attention to the adequacy of literacy strategies for these children. We highlight some strategies to develop and stimulate reading. Encourage interest in reading in books as early as possible. Encourage the family to develop reading activities in the home context. Teaching the literacy process using various resources, particularly technological resources. Provide summaries or pre-exposure to a new reading book before its initiation. Identify the storyline, plot, main characters, and setting with visuals, if possible, to situate the student to the book. Provide specific structure to questions when an answer is expected for comprehension. Use multiple choices, closed sentences with a word bank, or starter answers. Considering that it could be very difficult to answer, "John, how did the wolf find Grandma's house?" A student with autism can show understanding by asking, "John, did the wolf find Grandma's house by crossing the river and?" When giving choices, know how many choices are appropriate. Reducing the number of choices is a simple way to make a task simple for the student. It is important to be aware that a high proportion of students with high-functioning autism are adept at coding and using words, but may have significant problems with comprehension. Some pupils may be diagnosed with hyperlexia. Strategies to promote and improve writing. It is essential to recognize that writing involves expressive language skills, word retrieval, thought organization, and fine motor skills, which are often challenges for students with autism. Strategies to support each of these areas of need are often needed. We share some good practices when it comes to writing. Use visual resources to solicit language, images, workbanks, etc. Start with loose sentences. Educate and develop descriptive vocabulary. Use organization template tools for all written tasks, webs, outlines, etc. Because using these tools requires specific instruction and consistent, repeated use of them will likely result in greater independence and success. Consider the use of dictation, computer graphics programs to support the learner. Consider an AlphaSmart keyboard as a support resource. Search for content rather than staging or writing a play, knowing that writing may need to be assessed by alternative methods than those used for the class as a whole. For example, consider whether the student has answered the content questions rather than assessing only the writing. Strategies for approaching the curriculum. In addressing curriculum issues and making academic modifications or accommodations, it is important to keep the following suggestions in mind. Set basic curriculum objectives and focus on them. For some students, this may be as simple as 1 or 2 basic components within a unit. Teaching less content, focusing on what are essential learnings for that student. Make sure students have classroom materials ahead of time. Pre-teach new vocabulary and relevant key concepts, focusing on those that build and are repeated across the curriculum. Confirm that the information presented by the teacher is accessible to the student. Know how much verbal information the student can process. Consider ways of breaking down the information into manageable chunks, highlighting key points, providing outlines, study notes, etc. Use visual aids where possible to organize, enhance understanding, and evaluate. Consider in homework the establishment of a recording method, present set expectations, and consider possible schedule accommodations if necessary. When assessing, reduce performance expectations in areas of difficulty for the student. Consider allowing more time or an alternative configuration for testing. It is important to stress that if the student has difficulty learning a concept or skill, rethink how the material is being presented. It is also essential to keep in mind that if a student with autism has an interest in an area, they can become the class expert in a particular subject. This can be a way of allowing that student to shine, as well as providing an opportunity for motivation by using their particular area of interest to motivate flexibility or willingness to learn new subjects. Learn more about teaching strategies and practices for specific lessons in Module 5 of the Handbook plus Inclusive Education, Chapter 5.3. In conclusion, regardless of the pedagogical practices presented, it is important that all teachers be aware of the characteristics of autism as well as the specificities of each student should be considered to avoid or manage situations. Knowing your learning style, preferences, needs, and strengths are promising measures and of double student-teacher benefit. Be aware of communication challenges with students in the autist setting. They should request guidelines for communication from the special education team, knowing that waiting time for an answer to a particular question, the use of an alternative communication device, or the use of communication strategies such as photo exchange may be necessary. Collaborate with special education staff to provide strategies for curriculum modification, such as visual support, communication access, organizational tools, and directly teaching study skills, note-taking, time management, etc. Make sure that activities such as field trips, class presentations, sets, and plays are dealt with ahead of time. Think of ways in which the student can be included and discuss and plan for these with the support team. Field trips. Use a social narrative to describe for the student where the trip is, who they will be with, the reference figure, what will happen, and the timeline for the day. Where possible, include images. Be aware of the student's need to develop daily living skills and promote capacity and independence as much as possible. Explore opportunities for school staff to think creatively. For example, recess can be a great time for an intervention by a speech or occupational therapist who could model strategies and create games that daily staff and peers could continue on days when they do not provide direct therapy. The operational technicians present on the playground should be in tune with the strategies modeled by the students' teachers and therapists and ask for their help with sensitive areas. Remember that friendly greetings, acceptance, and patience can help make your child feel comfortable at school, and small responsibilities can help him or her feel a sense of belonging to the school community. Pedagogical practices, playground and cafeteria. Start the lunch queue routine 5 minutes before the other groups arrive. Reduce the number of choices. Visual programming can assist in the establishment and continuation of routine tasks, ensuring compliance, such as placing tray and cutlery in the appropriate places and managing behavior. Visual instructions and cues can be employed to help the child make choices or know how to initiate or respond. For example, hint card, "I would like chicken, please." Seek help to create settings for organizing games in a small group and in a quieter place in the playground. Use children with interest skills to motivate them to participate once the social demands are enough for her to work on. Set up and explain the rules for games in the courtyard. If the courtyard is too much for one student, set up a quieter area for board or card games. Use descriptive praise to build desired behaviors. For example, "I like the way you put the tray in place." Give positive instructions that allow incomplete language processing. Minimize the use of "no" and "stop." Instead of "don't stand in the hallway," tell the student who can't hear "no" or who doesn't know the correct place to stand, "please sit at the lunch table." Allow peers who are a reference for the child the opportunity to be a lunch buddy. Work with the school education team to offer social narratives to help the pupil understand a rule or expectation. For example, why sitting too close is irritating to a classroom, toilet or sink etiquette, etc. Work with the education team to offer written or visual support for unwritten canteen or playground rules and establish social conventions. Consider colleagues as support for vulnerable students. It can be helpful to have the help of other staff to find a way to pair students. For a pupil with particularly challenging behavior, work with the education team to develop and employ a specific support element of the positive behavior plan for needs at lunch or recreation. Never forget that it is important to be aware of the social vulnerability of this population of students and this propensity to be victims of aggressive behavior. Pupils with autism are not socially experienced, and therefore, if a pupil is being bullied or tortured into silence, they are likely to react or respond. The communication difficulties of a student with autism. Take the other classmates to understand the situation before arriving at a judgment regarding lack of behavior, for example. At school, everyone is invited. As a way to mobilize and empower all the human resources of an educational community, we point out the 10 Commandments of Helping according to author Diane Twachman Cullen. 1. Get to know all your students well and how their disabilities manifest themselves. 2. Learn the perspectives of your students and realize that they have considerable difficulties. 3. Always look beyond student behaviors to determine the functions those behaviors may serve. 4. Do not underestimate the strength of your students or impose rules that they cannot fulfill. 5. Provide appropriate support in relation to the level of skill development and behavior of students. 6. Promote the student's skills as well as independence. 7. Actively seek information to assist your students in preparing and implementing the support they need to be successful. 8. Do not usurp the role of teachers. 9. Leave your ego at the door of your home or school. 10. Perform your duties with full attention, responsibly, and respectfully at all times. Education and training in autistic spectrum disorder can take place in a generalized way where students learn that differences and sensitivity are not related to a particular student. It can also be an issue to be discussed in school assemblies or to be included in classroom programs adapting the content to the age level of pupils. Autism Awareness Month, April, offers many opportunities to focus on a class and learn more about the statistics and impact of autism. For younger children, the message could be more about the word autism and how to treat people who might be different with tolerance and understanding. Students from other school years could learn more about the specificities of this neurodevelopmental disorder, such as what they could do to help a colleague with an autism spectrum disorder. Autism education, training, and awareness. It is important that it takes place across the board, where students learn about differences in sensitivity are not related to a particular student. We have therefore produced the following booklet, which can be used as a resource by the education team. You will find the downloadable format in our Good Practice Guide, Module 5. All behavior is a form of communication, and in the case of challenging behaviors, these are no exception to the rule. There are in fact 4 main reasons for challenging behaviors. 1. They are trying to communicate something. 2. They want to see our reaction. 3. They are trying to balance sensory overload. 4. They are trying to do what they think will protect them. These are behaviors that should be identified and are not the fault of the child. Self-stimulating behavior, known as stimming, is a type of repetitive behavior. It includes rocking, jumping, spinning, head banging, repeating words or sounds, staring at lights or spinning objects. It is usually harmless behavior. Collapses, on the other hand, are usually caused by a complete loss of control when children are overwhelmed. Here, there can be risks to the child's physical safety. Whenever behavior occurs, it is important to consider the purpose or function of such behavior. While some behaviors are biologically triggered, many are learned over time and through experience, and shaped by what happens before and after a behavior occurs. Other behaviors may have started as a biological outcome, such as scratching, but may morph into something that presents a different function, such as scratching to get a teacher's attention. It is important that educational staff and families are aware of medical issues that commonly accompany autism, or, more specifically, challenging behaviors. Addressing these less obvious issues can often change behavior. In the Good Practice Handbook, we developed this topic a little further. Gathering information about pain and symptoms can be especially difficult in individuals with autism spectrum disorder due to communication difficulties, variable responses to sensory stimuli and pain, even in people with good verbal skills but lack of self-awareness. Challenging behavior may reflect an individual's only way of coping with a difficulty at a particular time. Without appropriate intervention, these behaviors tend to persist and may worsen, creating an increasingly challenging cycle for the educational team or family. Thus, promoting and teaching adaptive behavior as early as possible is essential for long-term growth. To develop best practice in this area, it is essential to empower ourselves as educators to learn and master the tools to deal and reshape challenging behavior. Many parents and educators make adjustments to adapt the behavior of the child with an autism spectrum disorder, but with time, there are deviations from the patterns that become a new normal. This can cause that, for example, families isolate their children from certain usual activities, such as a trip to the supermarket. The same happens in a school environment when, due to such behaviors, educators see the need not to allow the student to participate in certain activities, such as a study visit. It is important to stress that these attitudes on the part of educational agents compromise the child's opportunities for social interaction. Challenging behaviors can have a significant impact on the individual in many ways, such as disrupt learning and, as a result, limit long-term growth and development, limiting experiences and excluding a person from many opportunities for growth throughout life, including play, attending traditional classrooms, leisure options, and eventually work options, living conditions, as well as the ability to be integrated into the community, causing physical fatigue, pain, injury, especially when aggression and self-harm are involved. Compromise an individual's psychological states, resulting in depression, stress, anxiety, and reduced self-confidence and self-esteem. Impairs social relationships, as well as long-term interactions with siblings, parents, teachers, and other reference figures. Reducing independence and choice. According to Autism Perturbation of the Autistic Spectrum Acts, 2012, these are the most common challenging behaviors. Disruption occurs when an individual exhibits inappropriate behaviors that interfere with their surroundings. Example: the interruption of a class. These behaviors may include hitting, kicking, or throwing objects, knocking things over, tearing things, yelling, crying, or swearing. Evasion refers to running away and not returning to the place from which a person left. Incontinence. For some people, this can be a sign that there is a difficulty recognizing body signals before it is too late. Other times, this behavior manifests itself as a means of gaining attention or escaping an undesirable task or situation. Non-compliance is used to describe when an individual fails or refuses to follow another person's instructions, norms, or wishes. Non-compliance can be passive, such as not following a direction, or active, such as whining, complaining, becoming aggressive. It is worth remembering that non-compliance can be purposeful, but sometimes it can also result from lack of understanding, lack of motivation, fatigue, or poor organization, or motor coordination issues. Obsessions, compulsions, and rituals are often strong and irresistible urges that can result in a person finding it difficult to cooperate, cope with a change, or be flexible and adjust. Physical aggression, destruction of property. Self-harm is the attempt or act of causing harm to one's own body. For example, banging the head, slapping the head, biting oneself, squeezing wounds, and pulling hair. Self-harm, such as cutting the skin, burning, is less common in autism unless other psychiatric conditions co-occur. Sexual inadequacy can take many forms in autism and can be described as a lack of sexual inhibition. Lack of impulse control and poor social understanding can result in actions of sexual impulses that people normally keep to themselves. Depending on the severity and circumstances, sexual inadequacy can generate or be considered sexual assault. Threatening behavior includes physical actions that do not involve injury or actual contact with another person, as well as explicit threats to persons or property. Anger, or bouts of rage, is an emotional outburst that can involve crying, shouting, screaming, and stubborn or defiant behavior. The person may lose control of their physical state and may find it difficult to calm down. Verbal aggression. Person-centered approach. Looking at the person first and not at the disability or the behavior will be the most correct and useful, starting from the discovery of the person's strengths and challenges. The person-centered approach will allow the educational team to find the tools and strategies which will be most useful for the child when an ASD as an individual and for the professionals or family as reference educators. The family-centered approach is also important, so it is essential to consider the values, priorities, and specific needs of the family of the student with an autistic spectrum disorder. Ask all the questions that allow you to understand your student with autistic spectrum disorder, the dynamics of their family, priorities, strengths, challenging and disempowering factors. Positive strategies for behavior improvement. Often, the right approach to controlling and improving behavior involves a combination of physical or mental health issues and the use of behavioral and educational supports to teach replacement and self-control skills. There is no recipe or magic solution, just a set of strategies that can often be helpful. Here are some suggestions. You will find some more in the Good Practice Manual. Priority setting. When there are several challenging behaviors, it is important to prioritize. It may be best to start with the target behaviors that are particularly dangerous or the skills that can help improve situations in various behavioral settings. It is important to set goals that are realistic and meaningful. Start with small steps that can be developed over time. A nonverbal child is not prone to speak in complete sentences. Many skills take time to develop, and that behavioral changes require ongoing support to be successful. Positive behavioral support. It implies beforehand a functional evaluation of the behavior or an ABC analysis, an approach for understanding the behavior through the analysis of the antecedent, the cause, the behavior, and the consequence, the result. Subsequently, an intervention plan is defined. Transition between educational environments. In addition to the specific recommendations on the environment and the strategies already suggested, we stress how important it is to inform transitions and change. Recognize that change can be extremely unsettling, especially when it is unexpected. Grouping colleagues or staff appropriately for challenging activities or periods. Some people are calmer than others in certain situations. Building a sense of pride in one's achievements and personal responsibility. Celebrate and build on energy and successes. Tell the student what they do well and what you like them to do. Respect and listen to the student. Confirm the student's concerns and emotions. Provide clear expectations of behavior. Ignore challenging behavior. It may be difficult, but it is effective in the long run. Don't allow the students shouting to get them what they want. Behaviors can get worse before they start to improve. Be firm. Make sure all members of the education team are consistent in this approach and that it is not combined with other positive strategies. Alternate assignments. Do something that is fun, motivating, or that your student is good at. Then try something difficult. Offer choices, but within parameters. Provide access to breaks. Teach the learner to ask for a break when they need to recover. Promote the use of a safe and quiet place. Teach him to recognize when he needs to go there. This is a positive strategy, not a punishment. Establish reinforcement systems. Use simple, predictable processes that reward your student for exhibiting the desired behavior. Set aside times and a place for him to do what he wants. It is important to provide these options with school being such a noisy and crowded space. Reward flexibility and self-control. Choose your battles. Focus on the behaviors and skills that are most essential. Make sure to include positive feedback and intersperse opportunities for success and fun. Use positive, proactive language. More reactive strategies. Research shows that positive, reinforcement-based strategies are most effective in creating long-term behavioral change. However, it is also important to have an immediate response to a behavior in order to maintain safety or minimize confusion. Planning ahead and anticipating the type of possible situations is important. Ignoring the behavior, extinction, is a commonly used strategy when the behavior is used for attention and is mild or non-threatening. Ignoring difficult behavior means not giving into the behavior you are trying to eliminate. Redirection, which is often aided with visual elements, may involve redirection to an appropriate behavior or response and is usually associated with positive strategies. The removal of a situation or effort using a moment of isolation is often used to calm the person down. This quote presented here serves to clarify that when removing a situation, it is only effective if the student is doing an activity that interests or pleases them. It is important to note that there are certain behaviors, those that are dangerous or harmful, are harder to ignore and sometimes need to be redirected or blocked. For example, putting a pillow near the child's head so they don't hurt themselves while hitting, even while the adult makes an effort not to let the behavior win. Crisis situations. Generally, when the child is involved in the active and disruptive state of a behavior, such as an angry outburst or aggression, the main focus should be directed towards the safety of the child and those around him or her. It is important to remember that when a child is in full breakdown mode, they are unable to reason, be redirected, or learn replacement skills. However, this level of agitation usually does not start from nothing. It is possible, as an educator, to learn skills that help you anticipate and control an escalating behavioral situation that seems to be heading for a breakdown. Preparation and strategies for dealing with these situations and staying calm during them are key steps, and so it is important that the education team and family develop a crisis plan together. According to Autism S Perturbation of the Autistic Spectrum Acts, 2012, a well-designed plan will include definite events or signs indicating that a crisis situation may develop, tools and strategies to keep the person and everyone around safe in any environment, school, home, community. Intervention steps and procedures that promote the decrease in behavior and are associated at each level with increasing levels of agitation. List of things to do and not to do that are specific to the individual's history, fears, and needs. Training or practical training for carers and educational staff. Data collection and monitoring for continuous reevaluation of the plan's effectiveness. Knowledge of the best prepared facility in case a hospitalization or emergency visit is required. In the midst of a crisis situation, it is important that you stay as calm as possible, you assess the gravity of the situation, you follow the crisis plan and focus on safety, and you determine who to contact. To calm a situation of escalating behavior, be aware of the warning signs. Try to reduce elements of stress by removing distracting elements, offering a calming activity or object, or moving to a quieter space. Remain calm, as the person's behavior is likely to arouse emotions in you. Be kind and patient. Give space to the individual. Give clear instructions and use simple language. Focus on getting the person back to a calm and stable state by providing a few minutes in a quiet, relaxing activity. Praise attempts at self-control and the use of strategies such as deep breathing. Discuss the situation or teach alternative and more appropriate responses as soon as the person can calm down. Do a recapitulation with the person and the educational team so that everyone is prepared for further recognition of the signs and strategies of self-control in future situations. Often, when serious and dangerous behaviors pose a risk of physical harm to the person or others nearby, it is necessary to use physical restraints or isolation to maintain safety. Physical repressors include immobilizing or reducing a person's ability to move their arms, legs, body, or head freely. Isolation, putting the person for a few moments in a room alone to calm down, is often used in schools and other group settings. Isolation can serve as a quick alternative to an immediate threat, but in the long term, it is not a solution to the behavior itself, especially if the function of the behavior is to escape or avoid something. It is important to note that while restraints and isolation can serve to maintain safety, they are interventions that should be used as a last resort and only when alternative, less restrictive interventions are not effective, feasible, or safe. Misuse of these techniques can have serious physical and emotional consequences. Parents and carers should seek and receive professional guidance and training on positive behavioral interventions and supports, crisis prevention, and the safe implementation of restraint and isolation techniques where necessary. Educational resources. The learning characteristics of children with autism spectrum disorders are variable. The use of teaching resources and methods will help children to access all aspects of the curriculum. See Module 5 of the Good Practice Guide plus Inclusive Education for the advantages of applying these resources. From specific tools still to be explored in many countries, such as structural learning or universal structure of thinking, to fidget toys and graphic cards and organizers, we present some of the recommended resources to improve inclusion in the classroom context. Using pedagogical resources and materials, periodically assessing the students' learning skills and, based on these, planning the introduction of new skills, as well as stimulating verbal and non-verbal alternatives for the students' communication with the teacher and with other students in the school. More than giving guidelines that may constitute a recipe of how to do it, we want to alert to the importance of providing differentiated moments that may occur when creating an interactive environment, favorable to the learning situation, rich in instrumental and symbolic means. Do not be afraid to plan and experiment with motivating construction moments that seek better understanding and interaction among students. Finally, we leave you with a practical guide which we have called a survival guide, where we point out the first steps to take when you have a student with this disorder. Do not waste time to act. From the very first moment, the student needs to be welcomed, accepted, and understood by the whole class, starting with you. These are the steps. Firstly, it is essential to meet with parents and gather concrete information about what the student likes and dislikes, to determine what should be avoided and what can be done to motivate and control more disruptive behavior. Send this information to all the teachers in the class council and to all the auxiliary or operational staff. As class teacher or head teacher, you should seek reliable information about this spectrum and its main characteristics. You can ask the inclusive education teacher for help. Develop a pamphlet or use the one we suggest here to make available in school. Seek support with training. There are several specialist associations available to do this. It is essential that the operational assistants are involved and informed, as they are a fundamental part in the educational success of these children. They are often the reference adults who spend more time with a child. From the first moment, it is essential to work the class towards inclusion. Introduce a video and age-appropriate activities for the students in question to make them aware of the inclusion of their new classmate. Take a look at all the videos in the project. They will be very useful. Students should be aware of the limitations and potentialities of this colleague. Students should know which behaviors to avoid and which to promote. You can nominate a peer tutor, a student with the appropriate profile and who volunteers. We must all be alert because there are behaviors of the teacher, teaching assistants, and classmates that can generate moments of lack of control on the part of the student with ASD. These can only be avoided if the school community knows what these behaviors are. With the help of parents, we will know more quickly which actions calm the child down, and we can apply them when necessary. What you should not do. 1. Call the student by the diminutive of his name. He or she should be treated as the rest of the students. The diminutive name shows pity and coitism and paves the way for a capacitating discourse. 2. Avoid touching, especially grabbing or restraining the student in crisis or out-of-control situations. 3. Forgetting to explain any changes to the routine in advance. Example, if the next day there will be no music lesson because there is a trip to the library, the student should have this information in his possession in advance. He can't just know in the moment because this may trigger disruptive behavior, bringing out the stereotypes. Involuntary movements they cannot control. 4. Never put several exercises on the same sheet. It makes visual confusion and distraction and demotivates the student. 5. Doing things for the student or getting someone else to do them. The student's autonomy should be developed as much as possible and not let his colleagues do everything for him because they consider him incapable. Transmit to the class that if we don't teach them to do, we don't let them try, they will never succeed. Once again, the survival guide is not a recipe. All students on the autism spectrum are different. We may find a student with autistic spectrum disorder who loves to receive and give treats, for example. We should never try to change the student. It is the school that should mold itself to him. We should always believe that they are capable because they are. However, they can only show it if we give them the possibility to do it through a different pedagogical path. These words and this image shows us that autistic spectrum disorder goes far beyond what we can see. It is fundamental to assume the little we know, to learn to respect, and to know this neurodevelopmental disorder with more interest. To conclude, and as usual at the end of each module, we leave you with 2 questions for reflection. 1. What have you deconstructed in your way of thinking and seeing autism? 2. What changes to your teaching practice will you take away from this module? We hope this theme has inspired you. To conclude, we ask you to rate it on the link provided in the description of this video.